Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Well, happy Aloha Friday. Thank you so much for joining us here on Spotlight Hawaii. I'm Yunji Denise. Ryan Kalei Suji has the day off, but we have plenty of news to bring you. Right now, the COVID cases are cresting. It seems that every day those positivity rates go up and up. And so we wanted to bring you an expert today to talk about where we are in the pandemic. Also, a big headline this morning, the BA4 and 5 variants have been detected here on the islands. What does it all mean for us as we head into this graduation and summer seasons, party and gatherings going on, weddings and what have you? How do we stay safe? Joining us now is Dr. Scott Miscovich from Premier Medical Group. Thank you so much for being here, Doctor.
Thanks for having me, Yunji.
Okay, so let's start with that positivity rate. I looked it up right before we started. Statewide positivity rate, according to the DOH dashboard this morning, 18.3%. Honolulu County over 20%. Kauai County over 24%. What is going on with these numbers?
Wow. Well, it's a challenge to really interpret them, to be honest. I mean, one thing we really know is we currently have, per all calculations, the highest amount of disease in the United States by a long shot. We have about 5 states that are within about 20 to 30%, but basically we're double, triple, or 4 times about 30 other states. And that is what's recordable. The problem is we have so many home tests, as we've heard different experts say, the number we have, most of us will agree it's a wide range between 5 times to 10 times, which even Director of Health Libby Char said. So when you really look at those numbers, they're just a small fraction of what is happening in our state. So to really do a true percent positivity calculation, you have to take the total number of tests done divided by the total positivity. It's all unknown. We don't know. But what we do know is we have a surge that is currently going on in the state of Hawaii, which by all calculations has passed Omicron, which is now the highest surge of COVID that our state has experienced since the pandemic.
That is pretty terrifying when you put it in those terms. And what's interesting, Mara writes here, correcting what I said right off the top, which is we do not know where the crest is yet. The wave is building. Do we know, how high this could go?
We don't know for sure, but we have at this stage, 2.5 years in, we have a lot of data and analytics to predict. Now, one of the things that has enabled us to be quite accurate on predicting the surges and the duration of the surges is they're tracking from basically Europe to the eastern coast of the United States to across. So we look at places like the UK has great databases, Israel's great databases. We try to parallel the data from countries who have reliable data as well as similar vaccination rates and quality health systems. And you take that and you look at their doubling, you look at all the basic epidemiologic data, and you can kind of get some predictions that have been fairly accurate. The variability is what we're seeing right now. BA2 12.1 is now close to 2/3 of the United States. It was 58% earlier in the week. It's probably up to 2/3. So it's taken over in a very short period of time. And then you just mentioned, now we have BA4 and BA5. BA4 and BA5, if you look at the places where they have been landing in the eastern United States, they doubled every week. So there's math that will predict it. And the thing we don't know is what if, BA10 comes up? I'm just saying that as an example, if there's a major change or a major variation, but we can calculate fairly effectively where we're going. And I agree with the comment of the viewer. We're probably most of us are predicting we're probably at least well into the end of June before we could see the crust going down. It could be longer.
So with so much COVID in our community, let's talk about the hospitalizations, because authorities have said, from the governor on down, that it's really the hospitalizations that will determine public policy when it comes to masking, gathering size, and other COVID restrictions. Where are our hospitals right now? And given that you have that June as the crest, then late June, what does that mean for hospitalizations and deaths?
Well, we have a couple. We have three main issues. I think some of the reliable, most recent data that Hilton Rethel had passed on and Haima has. We were at 150 total COVID hospitalizations recently. That's probably going up by now. Most of us have predicted probably by end of next weekend, we're going to be over 200. And remember, same thing. That's predictable via databases. We also have HiPAM, our modeling group, who's doing the best they can with the data. It does give us some local data. So expect that hospitalizations will go into the 200s. Now, fatalities, as we well know, unfortunately, will track often 2 weeks to a month after the patient is hospitalized. So that's going to be lagging in the future. And then we've seen the delay in data, which has been explained as the medical examiner doing confirmation. So unfortunately, we are going to see a significant increase in mortality. We are going to see increase in hospitalizations. At this point, if there is good news, that's the good news. With a massive volume of positivity and the incidence of disease, we are definitely seeing decreased hospitalizations for multiple reasons. So that is fairly positive. Now, I want to throw out something that started your question that is a little bit, trying to protect the mayors of our state and our Department of Health. This is all flowing down from the CDC. The CDC on March 3rd changed the guidelines for how the country is supposed to evaluate COVID. And most of us were very disturbed by that because we basically feel that was basically pushed by the business community and the political community, and public health finished third in that race because they basically changed everything to say it's all based on essentially hospitalizations with some degree of information on positivity. As we well know now, we pretty much have lit up like red in the state of Hawaii. So we have passed in, even with the new guidelines, up into the highest category. So it's time to be concerned, but do I think we're going to go to the point where we're going to be pushing the edge and trying to get FEMA workers in? No. I think we're past that phase because of the treatments available and because of the amount of immunity that is present, both the variable immunity, which is the term used for when you've had infection and you're vaccinated, or purely the vaccination.
And on that policy idea, George White has a question. What policy recommendations does Dr. Miscovich make to address our current state of uncontrolled transmissions? I know that, we had talked before this program began about this idea of test and treat. Can you tell us a little bit about that?
I'll start though with one of the first things. It's back to basic mitigation measures. We're not seeing it across the country because, CDC has made it, optional, but indoor masks, really make a difference, and getting people well-fitted N95s that are valid N95s should be where we start. Now, test to treat is something the federal government started to pilot back in March. And essentially what we have seen as medical providers across the country and here in Hawaii is there's loads of confusion about who's eligible to get the medication Paxlovid. What are the side effects? Is it something to be worried about? Is it safe? Then it goes over to monoclonal antibody. Monoclonal antibodies are, if you're really high risk, it's an injection or an IV that you can get over a period of a half hour, an hour, and it's massively life-saving. 80, 85, 90% saves you from hospitalization or death if you're immunosuppressed. Paxlovid, it's for people who aren't quite that far off, but it basically still has held through each of these variants to still be in that 85+% range of stopping severe hospitalization or death if you meet one of the risk categories. It's really all over the map. People don't understand, am I eligible or not? How do I get it? Where do I get it? And so the federal government has launched a program called Test to Treat, where they want the ability for something that everybody will understand. Go to a site where you get screened, whether you're high risk or not high risk. Everybody gets, tested based off of the program. If you're positive and if you have high risk and you're positive, you stay on site and you're immediately given your medication or minimally a prescription, because there is a 5-day window of the start of the disease to when you are supposed to be starting on the medication, which is another major failure in our system, is timely access to testing, then tying over to a prescription, tying into the first pills going in your mouth. Twice a day, 5 days is the prescription. So we want to try to get across the state a program available where every community has access to a location for Test to Treat, where you can get a test that day if you're symptomatic and you're worried. And if you're positive and high risk, you're treated immediately, because Yunji, that will save lives and that will keep our hospitalizations down, which is what we're trying to do.
Now, you mentioned that this is a federal program. Would this be something that the state would actually administer? And how likely do you think that is? Because obviously time is of the essence if we're still going on the upward trend.
Well, the federal government side of this program seems to be the fact that they have made all the medicines available for free. So that's the federal component. I think they push it off to the states to say everything else is up to you. So Paxlovid and the monoclonals are no cost to anybody. Insurance, no insurance, it's just at no cost. But Yunji, as you and I have discussed earlier, we now have this little caveat where almost all the free testing programs have gone away. And so, there has to be some way to balance getting people access to testing that need it versus getting them stuck in the hospital or, God forbid, dying. So, yeah, it's a program that would need the states to kind of take some initiative. Yes.
Okay. I want to bring in some viewer questions here. And this one is near and dear to my heart because I have a 3-year-old. He says, Tamara says, can you please ask Dr. Miscovich about new data released for under 5 vaccine? If both Moderna and Pfizer are approved, any advice for parents on which route to go? I have a 5-year-old. She's fully vaccinated. In fact, we're getting her the booster this weekend. I'm so happy that she has that access. My 3-year-old, I thought it was going to be February, and then it was going to be May, and now I have no idea when it's going to be. So like Tamara, I'm wondering, what's the data on that? When can we get it? And is there a preference?
I'll give you answers to both. Okay, first, I want clear communication to the parents. And this is very important. You've seen the multiple delays. Why? It's because the Pfizer and Moderna have been very cautious in the dosing of the medication that they gave to the children, the infants at that age. So what happened is they found that they started very, very, very light, but it wasn't enough to produce the immune response that was needed to give the protection. So therefore, one of the trials they went with was adding the 3rd shot. Lo and behold, that's what worked for Pfizer. They have ongoing trials that have 2 doses with slightly higher amounts of the vaccine. So this is safe, and it was done very cautiously. So that's why there was a delay. Moderna, same thing, but they were able to get the data with 2 doses. Right now, if I had a coin flip, I would definitely go with Moderna. Easier at 2 doses. We've had Moderna across when it's head-to-head with Pfizer has a slight advantage of the amount of antibodies it produces and maintains. It's the safety protocols are fairly equal, sometimes a little positive for Moderna, but again, by and large, both are very, very safe. And that would be my answer. Moderna.
And when do you think that we can actually start to get these for our kids?
it's got to be in July at the latest. Should be late June. It should be June sometime, but there should be no chance it's any later than July. But my guess is late June.
Okay, we're waiting. There's some questions about these variants, and I'm interested to know if you've gotten COVID, because I feel like right now I know so many people in recent weeks who have gotten COVID. If you've gotten COVID, does that mean that you could get COVID again with a new variant, or do you have some natural immunity even from a new variant?
Wow, what a wonderful question. And it's a question that's evolving and has a very challenging answer. And the answer is Omicron 1, BA1, then we go to BA2, then we go to the Deltacron, BA2, 1, 2. Now we're going up to 4 and 5. There have been enough substantial mutations that have taken us from the original Omicron, where we have immune escape, and we're seeing that many people, even the majority, are able to get reinfected with BA212, even if they had Omicron. And we're even seeing it more now with the data. It's only 2 days old out of BA4 and BA5, because BA4 and 5 picked up another little piece of Delta that makes its affinity for the ACE2 receptor even higher, which is how that darn cockroach of a virus survives. It just finds way to just keep getting a little bit stronger. So yeah, you can still get it. Now, here's the good news. Your risk of death and your risk of hospitalization still is really, really reduced, significantly reduced. So you can have infection, you can have disease, but your chances you're going to end up in the hospital or dying is lower. If you have both immunity, the variable immunity, and you've been vaccinated, you're walking around it with a nice iron shield. Still could get a little bit of disease, still could get mild disease going forward. But again, death and hospitalization very well protected. And that's what the ongoing studies are showing, Yunji, that each variation that you've been infected with, does give you some protection, does give you some maintenance of protection, but got to end with some on a down note. All of them are waning over time, less and less and less and less. So that's why we're going to continue to get vaccinated.
Oh my goodness. Okay, and then there's a couple of questions also about long COVID. Let's say you survive that initial infection, you make it through, and we're seeing that you don't necessarily even have to have a very severe case to end up with long COVID. What are the implications that you're seeing for long COVID? There was a report out recently, earlier this week, that said, I believe it's 1 in 5 adults who get COVID can perhaps get long COVID. This is, the numbers are just too enormous to even think about, and the implications long-term for our society, not just here in Hawaii, but around the planet, it just boggles the mind.
Amen, Yunji. This is one of our big issues. This is why we are kind of just upset with CDC and, how lax they are with the masking and this new guideline, because yes, it's great people are not dying, but the long-term morbidity, the long-term disease that we're seeing right now is just, we're still calculating it. So yes, it's very concerning. Look at what we're dealing with. We've lost 1 million lives in our country. Another 250,000 of people have died for other causes due to the not accessing health care. And then look at the businesses. They're all trying to jump up. No wonder we don't have any workers. No wonder our workforce is decimated, because then on top of that, you have to add that you have another 20% of people will get long COVID. It goes on for 2 months. We're estimating up to 4% of anybody who's had COVID that survives will be permanently disabled. That's a big number. That's a big number. Those are parents. Those are future, people may be graduating from college, because it's not also age dependent. You can get long COVID, multiple different ages. It's not just in our geriatric group. So a couple of data points that if I can really shout out to the people who've had COVID, some of our new studies this week showed that quite a concerning increase in what's called pulmonary embolism, which is a blood clot in the lungs, and blood clots in your legs. We know this affects our vascular system. So, don't play around. If you've had COVID, even if it was mild, get back to see your doctor. Make sure they follow up, make sure they're knowledgeable. And then the other data point is 50% increased mortality for all cause of anybody who is hospitalized, meaning that they can die from so many different things versus someone not hospitalized. So we just don't know. It's affecting every organ system, every part of your body. And most of us will tell you we cannot predict what 2 years from now will look like when it comes to the chronic issues, let alone the psychological impact, which is tremendous.
Mm-hmm. I mean, given all of that, do you think it's time for the governor to reinstate a mask mandate?
I've gone public to say that that's the most simple, straightforward mitigation measure that works, that I would recommend. And yet again, not to fault the governor, because look across the country. We basically have really no one. Philadelphia has taken a few bold moves, but otherwise no one's really doing it. And so, the governor has been really, really probably one of the most progressive governors with the mask mandate. And President Lesnar did re-implement the mask mandate for the University of Hawaii Health Systems, which I commend him for. So I would recommend it, but I do think the governor's in a very challenging place, just with the climate and culture that exists with COVID, which is, unfortunately, what's COVID, let it rip.
I want to bring in this question from Robert, because I think that this is, other people may be experiencing this as well. My girlfriend and I recently got our first bout of COVID. We had already received the first 3 shots. Should we immediately get the second booster or wait a specific amount of time?
Great question, Robert. The answer is wait. You don't get it right away. You're carrying a lot of natural immunity already from having that infection. Where the data gets better and better as we go. And remember, it's probably going to keep changing with each variant as we go, because of what we talked about. You're probably at about a 4-month window, and might as well. That's a great lead-in, Robert, because actually, what you may want to wait for is, we are predicting that in the fall, when we hit September, October flu season, we will have the launch of what's called a bivalent vaccination. Bi meaning 2, where we're going to take components of the Omicron and probably pull out pieces of Delta, and they're going to be put into one vaccination to offer that to the entire population. No more over 50, no more whatever. It's probably going to be a new push, because what that will probably be is the beginning of what the future holds. Because then, as we skip to what the predictive analytics are for, and the planning is for 2023 cold and flu season, we're already getting a lot of companies, and you can imagine, Yanji, they're all racing to be the best on this, because it's billions of dollars worldwide, to create a multivalent vaccination. Most people don't realize the mRNA technology could house up to 42 different molecular designations for COVID in it. So we're going to find that using AI and computer predictability, as well as looking at the major ongoing coronaviruses that have survived since pre-biblical times, we're going to be trying to predict, well, what's it going to do next? So how can we stop it? And for those of you who say, ooh, that's scary, guess what? That's what we do with flu vaccines every year. Every year, we take flu from the southern hemisphere that circulated, figure out what it was, and put it into our fall and winter vaccine. And the flu vaccine changes all the time, trying to predict what the flu mutations are. Much slower mutation in the flu than in COVID.
Well, there are a lot of folks I know. I know this even in my own life. It's a conversation I've been having with my dad. He's eligible for the booster, but he says, oh, I'm going to wait for that super booster in the fall. What do you say to folks in that category? They're eligible for that next booster. Get it now, or wait for what you're talking about?
Get it now. And you get it now mainly because of what we talked. Look at the jump that's just occurred, BA2 12.1, and now 4 and 5. The data is coming out to say that you may have 3 or 4 times increased number of antibodies. It's not as much as 2 to 3, but it certainly just locks in your protection, right? If he's in that age group, get it now. That's there, no question at all in my mind. And why? On a risk-benefit basis, there's zero risk for getting another shot. I mean, we have no data that says, oh my God, you get a 4th shot, now you're in trouble. So get it. And,
I know we're almost out of time, but I want to walk through a quick scenario with you because this is happening to many of our friends and neighbors and perhaps some people who are watching this. Okay, you test positive with a home rapid test. You feel sick, but you don't feel, going to the hospital sick. What are the next steps? What do you advise people to do right now?
Okay, most important are you being honest with yourself. Are you at risk, right? If you are healthy as a horse, you're not taking any medicines, you're not overweight, you're good. Just quarantine, stay home for your 5 days. Don't contact people around you that, could be at risk. If you are masked, if you want to be around people, do it outdoors, use the trade winds, etc. If you get ill, get treatment available. Now, the other half, if you're at risk, if you're overweight, remember, obesity in the 25 to 50 is one of the highest risk factors for having severe disease progression. So be honest with yourself where your weight is. You have any kind of lung disease, asthma or COPD, heavy smoking, that's a second one up there that people overlook because they can be fairly common. Then we know blood pressure, diabetes, heart disease, immunosuppression, cancers. If that's your case, you need to find immediately, like we talked about at the beginning, Yunji, test to treat. You need to get on pills. You need to be on medication. If you're really severe, you need to be talking to your primary care and potentially getting the monoclonal antibody. But remember, you have a 5-day window, and you're supposed to do it 5 days from when your symptoms start. So don't hesitate. You need to know where to call and where to go, and you need to seek out that treatment because it can save hospitalizations or be life-saving. Hopefully that answers that.
Lastly, we see all these variants coming down the pike and it just feels like this is never ending. At what point are we going to be out of this? I know you don't have a crystal ball, but what does the future look like for at least COVID-19 here in the islands?
Okay. Basically, people need to understand we're never getting rid of it. The term epidemiologically is eradicating it. We'll never eradicate it. It's just too shifty. As a single-stranded RNA virus, it can mutate so much. We've already seen that. Get used to the annual vaccinations, as we've talked about. We're already reading our data talking about 10 years into the future. Now, what we do believe is it's going to continue to get less and less and less virulent. Let's clarify one thing. If you've never had COVID and you're not vaccinated, this strain is just as likely to kill you as any of the strains. So let's make sure that the only reason less people are dying is because they have some form of natural immunity. So, but we do expect that this will become part of the annual flu shot. We'll continue to have it, and it's going to be with us. It will eventually cross to that endemic stage. Technically, it's not going to be able to cross to endemic until probably into 2024. So we'll probably still technically have pandemic through 2023, but absolutely do not see COVID going away. It's part of a common cold and flu virus, and it's too shifty.
Oh my goodness. Okay. Lastly, I know I said that was the last one, but I'm just curious in your own life, how are you living right now? Because there is such a push-pull. You get invited to parties, graduations, weddings, what have you. You still need to go out. Do you go out to eat? Do you always wear a mask? What are your protocols? And then we'll finish our conversation.
Always have a well-fitting, well-documented N95 everywhere, every grocery store, everywhere. Anytime I'm going to even get close to people, even if I'm outside, I wear it. We haven't gone to a restaurant in 8 months, longer than that. So restaurants aren't happening. I do grocery shopping with my family. And because I have operations across the country. I have been on planes. I told everybody my standard plane, I wear my mask, I get 1 bottle of water, and about halfway through the flight, I open my bottle, I chug the whole thing down, put it on, and I never take my mask off again. So I wear my mask everywhere. And I have not had COVID. I did have my antibody screening. I've never had COVID. And, so most of my family, 1 out of my 4 children have had it. My wife and our kids haven't, because we're practicing best infection control. So it's, and for fun, we go outside and we're on trails and hiking, and, we go places that are a little bit separated.
Okay. All right. Well, that's good advice, especially on the plane. I know a lot of people will be heading out for summer travel, and that is one way to try to do it safely. We appreciate all of your knowledge this morning, all that you've shared with us. Thank you so much, Dr. Scott Miscovich.
Thank you, Nunji, and thank you and Ryan for your show. It's been a great addition to getting the truth about everything out there. So thank you.
Thank you. Aloha.
Aloha.
Well, always great to hear from him. If you missed any part of our interview, remember, you can always go back, and you can also listen to this as a podcast or catch us on Channel 50 KKI as a rebroadcast later today and throughout the weekend. We talked a lot about where COVID is in our community. We are not cresting. He believes that we are still surging and can continue to see that surge happen at least through the next month, through June. That will put a strain on our hospital systems, and he is concerned about the number of hospitalizations. One thing that we could do right now, as you heard him say there at the end again, is to mask up with a well-fitted N95 mask. And then he also talked about boosters, vaccines for kids, hopefully coming, kids under 5, that is, hopefully coming at the end of June or perhaps in July. And this idea of test to treat, something that is happening in other locations on the mainland, where you would go to a center, get a test. If you are positive, then get that Paxlovid treatment, which is so critical to get within the first 5 days if you're eligible for it. He also talked about protocols. If you do find yourself infected with COVID-19 and through a home test, different steps of what you need to do depending on your personal risk category. So be sure to watch that again. The bottom line is that we are still, unfortunately, in the midst of this pandemic, and that he does advocate wearing a mask. He thinks that it would be appropriate for Governor Ige to issue a statewide mask mandate, but at the same time acknowledging that the CDC has made that rather difficult given the recommendations that they have in place at the moment. We appreciate him and all he's doing for our community to keep us safe. And we appreciate all of you watching today. Remember to catch us right back here. We are taking Monday off since it is a holiday, but we'll be right back here on Wednesday with Governor Ige. So we'll have plenty to talk about with him then. Until then, have a great weekend. Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.